It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. We're going to continue just giving you all the knowledge that you need to show up as your best self. Now, AVEENO has built upon its commitment to combining scientific research with selected ingredients found in nature. Oat extract has been recognized for its ancient skincare benefits, particularly in managing dry skin conditions with finely milled colloidal oatmeal. And they've since built on this legacy with 70 years of clinical evidence supporting oat's efficacy, as well as advancing understanding of the skin's microbiome. I'm very excited to get into this chat with our good doc today because their expertise in skincare allows us to recognize that sensitivity is a barometer for skin health. Taking it a step further now, let me introduce you to someone very special. We've got Dr. Martinison, who joins us to discuss the prevalence of eczema and how it presents particularly in skin of color. And understanding this better helps us to better treat these skin concerns. Doc, thank you for being with us today. And in particularly, yes, I want to talk about eczema and eczema in darker skin tones. But let's talk about eczema from the get-go, right? What is it and how does it show up?
So eczema is also known as atopic dermatitis.
Okay.
It is a common chronic disorder, skin disorder that patients face, and it often leads to recurrent infections because there is, a loss of the skin barrier that can protect it. The causes are not entirely understood, but studies have shown that there is a combination of genetic and environmental factors. So there's usually a family history of eczema, asthma, or allergies, and then patients with eczema often have an overreaction immune system to environmental triggers.
I find that interesting. Are some people born with eczema and some people develop it later?
So it can be. It's a combination. So some people have in their genes, because some genes have been associated with eczema. There are many difficult names of genes that can be associated. But some people actually develop it later because of the environmental triggers.
Absolutely. That's really good to know. I'm curious about across different skin colors. I mean, we live in South Africa and we are a rainbow nation for a reason. Does eczema look different depending on how you present in terms of your skin color?
So it can look different, it can present differently. So doctors sometimes find it difficult to diagnose eczema in darker skin tones because as opposed to the bright red rash that can appear in lighter skin tones, in darker skin tones it can often be more like small bumps or more papular. So that's why it's also important.
You have to pause there. What is papular, Doc?
Sorry,
Come on.
like bumpy,
Okay.
like a road with many bumps in it. So sorry, papular.
Yeah.
And it can also appear as like splotchy grey-brown rashes that can be thickened, whereas in lighter skin tones it can be bright and red. So sometimes doctors find it difficult to diagnose, and that's why it's important to always tell your doctor about all the symptoms you're experiencing, because you might not think it's important, but your doctor who knows what papular looks like might actually find it important.
Now, there are other symptoms outside of the, what do you call it, superficial, right?
Yes.
The superficial symptoms that you can perhaps bring to your doctor and they can easily or more easily diagnose this?
Yeah, so it often presents as an itch, so it will be itchy, dry skin. It is often known as the itch that rashes, so it usually looks like a rash. It's often found in the inner surfaces of the elbows and behind the knees, so the flexural areas, and then often it can be in the face and in the creases of the neck.
Let's talk about treatment.
Yeah.
I've seen so many remedies. I think, especially lately, I spend a lot of time online, and on TikTok, there's been a big surge and push towards kind of leaving medication and figuring it out on your own. There are definitely natural remedies and people trying to figure this out. So where do we begin and what are the sorts of things that we can take after a diagnosis?
So I think, so many symptoms will have a different approach.
Okay.
So depending what you present to your doctor with, they'll treat it differently. But the first approach would be, what we think is the most important, is scheduling time for bathing and moisturizing. So it's better to do it closer to bedtime. It's also better to actually not dry the skin with a towel, but to actually, I know it's a bit difficult in winter, but to air dry and actually apply moisturizer while your skin's still damp. That would be like the most important. Also in bathing, not to have hot water because that can increase the dryness in the skin. So that would be just, daily things that you can do to avoid the triggers and to protect your skin barrier. But also a doctor can prescribe topical steroids. When you have a flare up, it can be on those lesions. Doctors can also prescribe oral steroids, but then that's more in, severe cases. And doctors only prescribe that for short periods of time because of the high side effects of it. And then if it has a secondary infection, doctors can prescribe antibiotics either topically on the skin or orally. And then you can also get antihistamines to treat the itch. Like I said, it's the itch and the dryness that is the most common thing.
And that combination just sounds like a nightmare.
Terrible.
You want to scratch, right?
Yeah.
And scratching is probably something we shouldn't be doing.
It's like a cycle.
Yes, exactly. That we're trying to get out of. I absolutely love that. Doc, perhaps if you can give some sort of word of encouragement to somebody that feels like I've constantly been doing this, especially somebody that's maybe darker skin tone that caught it a little bit later, what would you say, how can they navigate the space that they find themselves in?
I definitely think speaking to your doctor about it, like I said, telling them about all the symptoms, it is also often associated with asthma and allergies. So if you have asthma in the family, you must also think, is this maybe eczema that you have? What I can say, I know that it can be very daunting and it can be actually a very depressive cycle because patients are itchy, they're scratching, they feel like the aesthetics of it is not, it's not beautiful. So I think speaking to your doctor and then using those tips about the bathing and the moisturizing, but definitely trying to speak to somebody about it because you don't have to actually just keep it all in your head.
Now, Doc, thank you for joining us today. I think winter also aggravates everything and, kind of heightens what we already experience. I appreciate that advice and I hope that you are listening. And if you know somebody or are somebody that experiences eczema, this has definitely been some good notes to take. And while there's no single solution for coping with eczema, there definitely are lots of management strategies that can help. And of course, AVEENO offers dermatologist-recommended eczema solutions that help provide relief to eczema-prone skin, taking an active approach to restore your skin's balance, enabling you to embrace your healthiest and also, of course, your most confident self, which is exactly what we want for you.
Very dry, tight, sensitive skin. Relieve itchy skin in just 60 seconds with AVEENO's Skin Relief Moisturizing Lotion. AVEENO.